Hi, everyone, and welcome to the Gut Reset Summit. I'm your host, Dr. John Dempster, and today I'm thrilled to introduce an old friend of mine, Dr. Elena, or Dr. V, as she's known, and we go way back. But today I'm thrilled to have her here to talk a lot about gut, gluten, disease, and so forth. But I'm going to give you a quick bio about her because she's so accomplished and has many accolades. So, Dr. Villanueva is an international speaker. She's a health influencer and the co-author of the Longevity Code, a must-read. And she has been featured on Fox News, MSN, Healthline, the Houston Chronicle, and many other media outlets, as well as several documentaries. And she teaches evidence-based approaches for finding and treating the underlying causes of chronic illness, mental health conditions, and neurodegenerative disease. And her unique approach incorporates the merging of science and spirituality and the integration of mind, body, spirit. So, Dr. Elena, great to have you on the Gut Reset Summit, and looking forward to our chat today.
Yeah, super excited to be here and offer some of my knowledge.
Great. Well, listen, I know everyone's got a story, and I know you have a story. So, how did you end up in this healthcare space, health and wellness space as well?
Well, I always had an interest I knew from the time I was a little kid that I was going to be somewhere in the health and wellness or medical space. Um, and so I pursued that, and I decided to go into working more in sports medicine when I was younger. So I've been in practice around 20 years. And I had an interest in functional medicine, holistic medicine 20 years ago. I also realized that the timing wasn't right. People really didn't know what that was back then. And so I opted for sports medicine. And I was a few years into my practice. I actually had three practices around the time I started getting sick. And I ended up becoming so ill without any answers or solutions from the traditional medical model. And I had family who are medical doctors and surgeons. And so I had some ins with the good neurologist and, all of the really good doctors, and no one had answers and solutions. And I ultimately almost died from my physical illnesses that kept, getting worse over time. And then also a lot of neurological based issues that ended up happening where I developed aphasia. I couldn't talk. I lost, complete loss of my memory. It was like I had dementia. But yet nothing was showing up on my lab. So they were patting me on the head and telling me that I was just a stressed out single mother and that I'd just go home and take this anti-anxiety medication. And so long story short, I came at a really crazy crossroads in my life. I either, needed to figure out an answer or I was ready to go because I didn't want to live like that. I ended up losing all three practices. I lost my home. And I was pretty devastated, as you can imagine, with all of it. And I was just really, really fortunate because I really felt that source or God, whatever we want to call it, really had a plan for me. And it took me many years to get my health back. But with my background, medical education that I had, and the opportunities that came my way to get the help that I needed, I was able to put the pieces of the puzzle together. And there were many facets that needed to be addressed in order for me to heal. I was able to put it together. And over the course of 10 years, I was able to get my health back. And that's why I do what I do today, John, is so that I can show other people that it really takes a multifaceted approach in most cases to heal from chronic illnesses, chronic being people that have been sick for 3 or 4 or 5 years or more.
Yeah, well, listen, and I know your story. I'm glad that you're sharing it with everyone who's listening right now, because a lot of people can resonate, and yours is so powerful. And I know how passionate and how knowledgeable you are in this space. So this will be a very, very powerful talk, I think, for people to listen to. But for you, can you show or share a couple of the connections for you that really helped to launch your healing? I know you've touched on a few of them there, but in terms of, the power of the gut, was there anything there that jumped out at you in terms of, okay, that was an important factor of my healing?
That was certainly a very important factor in my healing. I had started having gut issues from, when I started looking back on my lifetime, I had started having some gut issues from the time I was a kid. And I was, I was, I was bottle fed. because back in the early 1970s, when I was born in 71, that was the fad. Oh, you shouldn't breastfeed, you should use this formula. So my mother was doing all of the things back then that was the fad of the day. And then I started getting really sick all the time. And so I was on multiple rounds of antibiotics. And I really did have gut issues from the time I was a young child. And they started really getting bad when I was in my 20s. And so yeah, looking back, I can see that the gut was one of the many issues that I had. And as we know, the gut contributes greatly to multiple different systemic engines in the body. It's contributing to a lot of your brain functionality. If your gut is not working properly, it's going to affect your brain, hands down. There's no way around it. It's also going to affect your hormone production for your reproductive hormones. It's also going to affect the ability of your immune system to work for you. And so those three things alone, those are huge systemic engines in the body. And if we can't understand how to keep our gut healthy, those are domino effects that most of us are going to end up suffering at some point or another, secondary to gut issues.
What are some of the biggest gut disruptors that you see in your patients today that you may have experienced yourself? But what are the common denominators that you're seeing over and over and over again?
Oh my gosh, the common denominators. I love talking about that because that's how we have been able to help so many people, is by understanding, like, what are you seeing across the board in 9 out of 10 people? No matter what you come to us for, whether it's this autoimmune disease or that autoimmune disease, this mental health issue or that mental health issue, this skin issue or this GI issue, or these allergies or whatever, we do see common denominators. And when it comes to gut dysfunction, whether people realize it or not, because a lot of us can have a dysfunctional gut and not really realize it because it's not super extreme, right?
Mhm.
Like, for example, or they don't think it is. If they've had constipation all their life, they think that's normal. They don't think that, they don't think there's anything wrong with that. But the common denominators are from our environment, number one. And this is inclusive of a lot of things. We're talking about environmental toxins that we're exposed to every day. Women, we put what, an average of 9 products on our bodies, hair and face, every day. And with those 9 products, we're getting like over 120 different chemicals that are known to cause disruption to our gut ecosystem. They cause hormone imbalances, brain chemistry imbalances, autoimmune issues, weight issues, blood sugar issues, on and on and on, right? And so when we're looking at our environment, we want to look at the toxins that we're being exposed to in our air, water, food, and our personal products. We want to look at mold toxicity. We find another common denominator is that, so we find that 99% of people who come to us who have been sick for 3 or more years, Dr. Dempster, they have 3 or more chemical toxins in their body that have greatly affected their gut and caused a domino spiral effect of affecting other systemic engines in their body. We find that around 70 to 75% of people, common denominator, who have been sick for 3 or more years, with no matter what it is, have at least one toxic mold in their body. And we find that 20 to 25% of people who have been sick for 3 or more years, again, no matter what the diagnosis, symptom, or condition is, 20 to 25% of them have some sort of radioactive material or heavy metal in their body. So when we're looking at environment, that is a huge disruptor. And because we live in such a toxic environment, even our children are having really big gut issues these days. And sometimes it's manifesting as a gut issue, but more commonly, as you know, it's manifesting as a lot of skin issues, psoriasis, mental health type issues, brain related issues, defiance disorders, all these things. And we can really tie a lot of it back to environmental stuff. Now, food is, you can kind of sort of classify it as environmental toxins, because if you're most people eat processed foods, and that's not even real food. It's toxic chemical cocktails is what it is. And so you're putting these chemicals in through these fake foods that we're eating. So those are some of the common denominators that we're finding. And then there are others too.
So let's first of all, I love that you touched on as my wife says, potions of motions, things that we put on our skin. The saying rings true, is that don't put anything on your skin that you wouldn't put in your mouth. And so we have to always look at that, because I think a lot of us just without thought just will slab on whatever we need to do from personal care products. But how do these toxins, like what are they actually doing on the gut itself? Maybe just walk us through just high level. We hear a lot about leaky gut. We hear a lot about gut inflammation. What exactly are they doing that causes so much damage?
Well, this is the thing with the toxins is that they do have different mechanisms of action, but some of these environmental toxins, take pesticides, for example. So pesticides can really alter the gut microbiome or the gut ecosystem and cause a lot of dysfunction because it's acting kind of like an antibiotic. I mean, think
Mhm.
about it. These pesticides are designed to kill bugs. They're not discriminating what kind of bugs, they're just killing bugs. And so when we're getting it in our municipal water system, so every time we fill up a glass of water from our faucet, right? Or when we're eating foods that have a lot of glyphosate in them, which if you're not eating organic, you are getting glyphosate. Or if you live by a golf course, that's another, we've seen that under with some case studies that we've done with clients who live by golf courses. Even if they eat fully organic, they've got really high glyphosate levels and they can't get them down because it's probably in the air. They're like breathing it in all the time. But that's killing all the bugs in your gut, the good ones, the bad ones, everything. There's no discrimination. And it's causing inflammation to the gut lining and it's breaking down that membrane inside the gut that needs to be intact so that the gut can do what it's supposed to do. So that's one example. And then you have other types of chemicals that can also cause issues, maybe different. So, for example, you might take a chemical like something that's a plastic, and maybe directly it's not going. We have a lot of plastics that we're finding in people's bodies now, right? And so, like BPC, and so that is going to directly affect your ability to uptake certain nutrients into the cells. And it's going to prevent your body from making certain nutrients. And those nutrients are made in the gut. So it's like acting like a wall. It's acting like a barrier. It's not directly like killing the bugs in there, causing a cascade effect. But what it's doing is it's acting as a barrier where the nutrients can't be made or they can't be moved into the cells. And then that's causing a cascade effect of GI issues, or it's causing a shift in hormone
Mhm.
chemistry production. And I'm not sure exactly the mechanism of that, but I know that it's doing that. And we know that we have a lot of our hormones are also made in our gut, not just in our reproductive organs. And then you have things like mold toxicity. And mold toxicity, that can really disrupt the GI tract because our bodies are warm, they're dark, they're moist, and they're full of nutrients. It's a perfect place to house mold. Think about that, right? I mean, mold, once it gets in our bodies, it can be in there for decades, keep making us sick, and we don't know why until we find a doctor who thinks to test for it, right? And that, in order for mold to survive in the body, it has these fascinating mechanisms of survival, just like all bugs do, all animals do, right? Whenever you watch on the science shows, the one of the most powerful mechanisms for survival that mold and other bugs and parasites who live in our body, what they do is they produce this slimy substance called biofilm, and then they burrow themselves within the walls of the biofilm. It's like a barrier, it's a shield. And so our immune system, it knows that something's there, but it sends the troops out to go find it and contain the threat. And although with different white blood cells, they're going around and they're like, I always like to say they're radioing back to the home station going, well, I know there's something right here somewhere, but I can't find it. I know there's something here, but I can't find it. And so, and that's because it's burrowed in this shield that it created in the biofilm.
Mhm.
And then it starts attracting other bugs that don't play well inside of our body, other types of bacteria and viruses. And the next thing you know, you've got a party going on inside of this protective shield. And it's breaking down the healthy ecosystem of the GI tract, breaking down this permeable layer that we have, killing off the good bacteria. And so that's another example of how certain substances from our environment can actually disrupt our gut ecosystem.
And you can get this perfect storm effect of all these things adding up together and getting this synergistic effect. Absolutely. I literally, right before our interview today, I had a patient who we measured their mycotoxins, which are the toxins elicited from certain mold species. And one of her toxins, called aflatoxin, was 30 times the allowable amount. And this patient has been chronically ill for a long time, and we're just beginning our work together. So very much looking at that as a big factor for this person's recovery as we pull those toxins out, as you've done with probably hundreds of your patients, thousands of your patients. That's when the magic starts to happen. So, the molds can't be understated. This is a big deal. Where do you see the source of molds coming from? Do you see them from multiple sources?
That's the thing. Unless you've been following people their entire life, you really don't have irrefutable evidence of where it's coming from. But what we do know from the research that we've all done is that oftentimes mold is hidden in people's homes. And it's not always visible. Sometimes it is. Like you might see the mold growing along in the shower. So we take some bleach, we put some new caulking down, thinking that we're taking care of it. What we don't realize is that it's still there. It's underneath, and the bleach doesn't really kill it. Most of the time, mold is hidden in places in our homes that we don't see it. It's hidden in the ventilation. It's hidden under the floor. It's hidden behind the drywall. It's hidden behind the wallpaper. It's hidden up in the attic, and it's making people sick. And it's in places that they don't see it. It can also be found in our food sources. Yes, it can. I believe, and this is debatable, but I believe that when we find super high levels of mold in people's bodies, I don't believe that's just from food.
Mm-hmm.
In most cases, I believe most of the time that's because they had some sort of exposure somewhere. They grew up in a house that had it, or a vacation home they stayed in, or a hotel room they stayed in, or it could be cumulative. Multiple places where they've lived over the years have had mold, and maybe they knew it, maybe they didn't. Maybe where they worked in an old government building or an old schoolhouse that had mold, an old lawyer's office. These are all places where I've had clients tell me, yeah, I remember it always being musty when I would go and teach at the school, or when I was, at the university or over at the law firm. It was always musty in there. They were probably getting a lot of mold exposure there. And then they may remember that they had exposure to mold when they grew up on the farmhouse, or they grew up in New York, and they remember that there was like a soft spot on the floor, and then there was a little bit of mold, but they never knew that that was the culprit. So you can have this cumulative effect where you're exposed multiple times over the course of your lifetime to different molds, sometimes the same molds. And the thing is that our body doesn't have natural mechanisms to get rid of it. And mold is super stealthy. It starts, as soon as it gets in the body, it starts creating that barrier, that invisible shield to hide from our immune system. And so, you can get this cumulative effect over the years. And by the time we see our clients, they're, between, 60, 70, or 80 years old. And they've had this cumulative effect of getting molds in different places that they've lived throughout their lifetime. And they've got it stacked up. They have a bunch of mold in their body.
So how do we get rid of it? What's the best way to start to pull this out of somebody so that they can feel better?
The good news is that you can get rid of it. We can get rid of virtually any toxin in the body, even radioactive materials. And how do I know that? Because I have case studies to show it. But it just takes time. That's the biggest thing that people need to understand. Our studies show that it takes an average of 9 months to get mold out of the body, an average of 9 months, usually within around the 4-month time frame. If you were to retest them 4 months in, their levels are going to appear to be higher. Why is that? Because their body is dumping it like crazy. It's just dumping it. And then by the time that you retest them around month 6, 7, you typically see that it's 50% or more gone. And then by the time you get to around month 9, 10, 8, 9, or 10, depending on the person, it's all gone. And so the first thing to remember is it's not so much how, because there are a lot of protocols as to how you can get the mold out, but it's really understanding the time that it takes and why testing along the way can be so valuable. It can be a valuable resource so you can see, and so that your patients and your clients can see that what you're doing is actually working.
Mhm.
In terms of protocols, there are different binders that are out there that can be used. So, I mean, you have things from humic and fulvic. I have done case studies using just plain humic and fulvic and been able to get mold out of the body. I've also taken other binders to help to release and bind to mold. There are others that I may not be, like zeolite clays and different things like that, activated charcoals and things. I'm not as big of a fan of some of those, only because when a client is sick, they're typically on a protocol, which typically involves around 8 bottles or more of stuff of
Right.
different things. And when you're having to remember, I need to take this in the morning, I need to take this around noon, I need to take this in the evening. Oh, but these special binders I have to take in between those times because I can't take it near a meal. That can be super overwhelming for a client, right? And so we have over the years moved away from using certain ingredients that require the client to not be, to have to do it in between meals. And we have been really, really dialing in more on what types of combination of things can you use that can help pull out not just mold, but all the other stuff too, because we know they've got chemical toxins and we know they've got other stuff with the mold. What can we give them that can pull all of it out without having to take 7 different bottles of stuff just to pull out those toxins out of the body?
Is there any particular diet that you put them on during this?
Anti-inflammatory is the generalization, right? And for everybody, anti-inflammatory can mean something a little bit different, as you know, right? But for general purposes, when we're working with people and we put them through our teaching program where we're teaching them how to do this stuff for themselves to give them their sovereignty back over their health. It's more of a group led and it's less expensive. It's not one-on-one, but for the majority of the people, when you take into consideration all the common denominators, right? Anti-inflammatory works for most people. And that if we're going to simplify that, that means making sure that you're doing a reverse osmosis filtered water with your minerals added back in to make sure that your water is clean, because most municipal water systems have a lot of toxins in them. And then staying away from the most common inflammatory foods, right? We're talking dairy, we're talking sugar, corn, and wheat based type grains. And so generalizing, that's what we do. But when we're working one-on-one with people, or we find that someone is struggling doing a more generalized approach with an anti-inflammatory diet, then we'll come in and we'll look under the hood a little bit deeper, and we'll find out, well, maybe they're having bigger issues with lectins, maybe there's bigger issues, and we need to cut out other foods. They may have developed really big sensitivities because of long-standing many years of leaky gut. They may have developed these massive sensitivities to otherwise things, foods that we would consider as healthy anti-inflammatory foods. So we have to really dial it in even more. And we can do that with testing these days, as you know, right? So testing really can help us dial in for those more complex cases.
I love that you alluded to the fact that corn might not be the best food. Now, hold up. We always hear that corn is gluten free, and we'll talk about gluten in a moment, but why can't we eat corn? Fill us in.
Well, and I want you to jump in too, because I might learn something new. But corn is known as an anti-inflammatory food. And some of the things that I know about corn is that most corn is genetically modified. It's hard to find non-genetically modified corn these days. If it is genetically modified, supposedly it already has glyphosate in it. That they genetically modified a lot of these foods to already have glyphosate in it. And then when you genetically modify a food, your body doesn't recognize it anymore. It's not from planet Earth.
Yeah.
It's not a part of this ecosystem. It's something foreign, and the body does not recognize it. And we don't know what it's doing to our DNA. We don't know what it's doing to our RNA. Long term, we don't know what these genetically modified foods are doing. Secondly, a lot of the corn, if it's not non-GMO and if it's not organic, it's going to be heavily laden with pesticide.
Hmm.
So, now you're getting pesticide on top of something that's genetically modified it's not real food. It's not from this earth. It may look like corn. It may taste like corn. It may smell like corn. It is not corn if it's been genetically modified. And so those are a couple of the reasons. It's also full of sugar, and there's not a lot of nutrient density in corn. I mean, think about what they use corn for. And I'm not saying that I don't love corn. I'm Mexican. I love corn tortillas. I love corn chips. I do. I mean, I like it, right? But I'm also very, very conscious about it. And I understand when I eat it, it's going to be a non-GMO, it's going to be an organic, and it's not something that I'm going to do every day unless I want to start plumping my body out. But corn is used to fatten up farm animals. Why do they give them corn? They give them corn to fatten them up before they take them to the butcher block. So like, why do we want to eat that as a regular part of our diet? This is what I tell people. Let's be realistic. I'm not going to go crazy and tell you you have to eat a certain way for the rest of your life, and you can't ever have a glass of wine, and you can't ever have corn chips and salsa, and you can't ever go out to eat. Look, that's not the reality. And we're not going to live in a bubble. And I would never tell you to do that. I enjoy my wine sometimes. I enjoy corn chips. I love going out and getting great Mexican food. But when I'm sick, if my body is worn down, like last year that happened to me, I was working too much and I didn't realize it, and I started getting sick. And you have to nurture your body. Food is your medicine, and there's no amount of supplementation that will ever out supplement eating the right food. Food is your medicine. And so if you're struggling with illness, and you're not back to a point of being totally whole and totally healthy, then stay away from the things that are not considered food as medicine. Once you get to a point of health, you can make those decisions, what you want to do, but you'll do it from an educated perspective, from the lens of having more education and understanding. Well, if I put this into my body, this is the reaction it's going to have. And so you just need to approach your foods with a little bit more, with just a clearer lens.
Beautifully put. The analogy I'm thinking of as you're explaining this is like we're trying to push this massive boulder up a hill. And at the beginning, that's very hard. But as you start to crest that hill, you can take a little bit of, you can back off a little bit. And potentially when you get to that point of healing, that's when we can start to say, okay, we can create a little bit more balance in our life. But we have to listen to how our body receives that information and how we feel and look going forward. But yeah, corn is an interesting conversation, one we could talk a lot more of. I think you nailed down all the big parts. All I know is that I can tell you in Canada, 92 to 94% of it is genetically modified. It is a big deal. It's hidden in a lot of the gluten-free foods, which we sometimes mistakenly think are healthy. We have to be very careful about the gluten-free trap. And, there's a lot of talks on this summit about gluten, so we won't get into the gluten side of it too much, but watching out for those toxic gluten-free traps is real. There's a number of other proteins found in corn that right now there's over 200 different coding proteins that are gluten related that can actually trigger gluten receptors. So it's this great mimicker in a way. And it's quite, it's considered a very benign food, but we have to be mindful of it. And I think you said it very, very well. Don't be scared to death of it. Just be mindful of it when you're in that healing process.
And I like what you added about how it can mimic a lot of the components of gluten, because gluten can be one of the big root causes of more than 300 different symptoms, conditions, and diseases. And I mean, no, none of us want to hear it. Look, I get it. If you're listening to this and you're watching this, none of us want to hear that. We all want to just sweep that one under the rug, because what do we think of? It's like it's a dopamine hit when you think of a really good warm French bread or a really good pasta or just a really good sourdough or, like a really yummy sandwich that's just like, yeah, we all of us grew up eating that kind of stuff. We all grew up eating that. And this is the thing, though, we can no longer ignore the fact that gluten is killing a lot of people. And, and now we've got not only the testing to help us identify and prove it so it becomes more real to you, but we also have genetic testing out there that can show us that as well. And corn, you're right, corn also can mimic a lot of the components in gluten. And so this is why working with someone like Dr. John or the other experts, or myself, it can be so valuable in your healing process, because we understand that there are usually multiple factors involved that have all come together, creating the perfect storm to create dis-ease symptoms, conditions in your body, including massive gut issues and leaky gut that just exacerbates every other systemic engine in your body. And so by working with the right people who understand how to look under the hood and really start to look at all of the different facets that are typically involved, that's where you're going to get your answers and solutions. And then that's where you're going to get your long-term and sustainable healing from.
Awesome. Yeah, well put. Dr. V, I want to pick your mind on one more toxic gut bomb, as we say, and that's heavy metals. Tell us a little bit about why these are so important, how they impact our gut and our overall health and well-being.
Oh my gosh. Heavy metals are really bad. And unfortunately, it seems like we keep getting more and more exposure to heavy metals, and we're seeing radioactive materials that we're seeing, which is just incredible, the amount of radioactive materials that we're now seeing in people's bodies as well. And they will block cellular receptor sites. They will block chemical reactions from happening. And so it can short circuit all of the nerve impulses in your nervous system, for example, creating massive neurological issues. And so, there are multiple things that are bad about the heavy metals, but one of the other things that makes heavy metals so difficult is that they bind very tightly to our cells, tissues, and organs. And so it can make it very, very hard for them to get out, to get them out of the body. So while we talked about earlier that it takes an average of 9 months to get mold and chemicals, by the way, out of the body, an average of 9 months, heavy metals can be a whole nother story. You can take something like, lead or mercury, and you can be working on that for 2, 3, 4, 5 years to fully get that out of the body. And then there are other heavy metals that actually have a short half-life that'll come out of the body very quickly, like arsenic. A lot of us know how bad arsenic is. We've actually seen people with arsenic poisoning. We had one client die from arsenic poisoning that her doctor sent her home with pain medication and psych meds, basically brushing her off, going, "We don't know what's wrong with you." And she was writhing in pain, having all the symptoms of arsenic poisoning. We did the testing. By the time the testing results came back, she had died. Wow. And so it's really important for us not to overlook, right, that when we're sick, there's a very, very high possibility that you've got chemical toxins, mycotoxins, or heavy metals going on in your body that are not just affecting, your brain. They're affecting your gut. They're affecting your immune system. They're affecting your fertility. They're affecting your ability to move oxygen through your cells. They're causing osteoporosis. They're breaking down your bones. They're doing all kinds of really, really bad things. And so, testing is where it's at, Dr. Dempster. I really do believe that. That's how we can really understand all of the reasons why we're sick. And then that's how we can put a real plan of action together so we can get ourselves better.
Absolutely. Yeah, we rely heavily on data. When we test, we don't guess. And I know you and I link arms in that philosophy. But heavy metals, once they're in there, again, that's just maybe a couple of salient tips. How do we pull them from our bodies? Is there anything that you see working better than something else?
So we'll use a combination of chelators, and then we combine those with binders. So this way we can unbind them from the tissues. And so there are different things that can be used for that, like high dose Practicel chlorella and different alginates can do that, right? Humic fulvic can actually unbind and then it can rebind and carry it out of the body. So that's interesting that we've been finding that lately. Citrus pectin fiber is a great binder also. And so, when you start combining these different things together, the chelators with the binders, the chelators will unbind it from the cells, tissues, and organs. Now it's free floating in the body, but you've got to bind it quickly because if you don't, it's going to hit you right in the bloodstream and it's going to travel to another part of the body, maybe go through your blood-brain barrier. And now it's going to redeposit from where it might have been in your liver. And now it's going to redeposit up in your brain, which can really cause serious problems. And so this is something that you don't really want to do on your own. You really want to do this where you're being taught how to do it and you have more guidance. Because you really want to make sure that you have the appropriate amount of binder, the appropriate amount of chelators combined with the appropriate amount of binders. And then just the retesting is going to be important as well so that you can see the progress that you're making.
Awesome. Yeah, this is so huge. And, these neuroendocrine disruptors, given that our second brain, arguably our first brain, is in our gut, we want to make sure that we're getting rid of these as best as we can because they can not only create all sorts of digestive related issues, but as Dr. V is saying, they can totally be a trigger for autoimmune disease elsewhere in our body, mental health issues, and this is such a big area that you focus on, Elena. So, this is where we hear of this leaky brain. And, we're quite familiar with leaky gut, but tell us a little bit about what leaky brain is about.
So there are multiple systems in the body that are contained systems. So I like to start out by using the blood system, our venous system. So our blood travels through our veins and our arteries, and it needs to stay contained inside of the veins and the arteries. If we have a hemorrhage, meaning that like if we have like a big vein that bursts or an artery that burst on the inside from a car accident or something, a knife wound or whatever, or we even cut ourselves from the outside, when the blood gets out of its contained system, it is very damaging to the cells, tissues, and organs in the body. It needs to be contained inside of its vessels. Okay. And we have other systems like that too. Our gut is the same way. Everything that travels through the gut, it's got its own ecosystem. It's got its own enclosed system, and it needs to stay closed the way that it is. And when we start to have micro tearing or openings inside of what is supposed to be like a selectively permeable membrane, meaning it's an enclosed system, but it only opens on command when it's supposed to let certain nutrients through to do its job. Whenever we have stressors or toxins or emotional trauma or medications or toxic foods that we're putting in our bodies, they create a leaky gut system. So now the gut is no longer this contained system the way it's supposed to be. It's leaking particles out into the body, creating alarms in our immune system because our immune system goes, well, what's that? That's not supposed to be there. And it's doing that constantly every time we eat or drink something. The same is with the brain. So the brain and nervous system, it has its own contained system as well. And it has a selectively permeable membrane, meaning that the membrane's closed. It has secret doors that will open, but on command from the intelligence of the body, where the little doors will open to let in certain vitamins or certain minerals or certain fatty acids or to take out the trash, the doors will open. But if you have any type of head trauma, for example, you can create a breach in the blood-brain barrier. You can create a breach in there where now you have this leaky brain. The membrane is no longer working the way it's supposed to keep stuff out and only selectively let things in and take things out. And then there are other things that can create leaky brain as well. If you have leaky gut, you are eventually going to have the domino effect of having leaky brain as well. The gut and the brain are so closely tied together. Any issue that you have in the gut is going to cause a cascade effect in the brain as well, typically leading to leaky brain as well, which is going to allow the toxins that are in your body to very easily or more easily cross that blood brain barrier and get inside your brain, which can then cause, that's a whole nother level of trouble.
Hmm. Yeah, and I know you've been an expert in the leaky brain conversation and think tank generally about this, and you're doing amazing things, Dr. V. And I'd love to just learn for everybody listening right now, where can people find you online to learn more about how to not only remove a lot of these toxins we've talked about, but also in terms of healing themselves, gut and brain together? Where can we find you?
Check us out on the online. You can go to Google and go to modernholistichealth.com. We also have a lot of great videos, Dr. Dempster, on YouTube at Modern Holistic Health. So you can go check out different videos just to get to listen to stuff and watch and learn. So go and check us out. We're here to help in any way that we can.
Well, Dr. V, this has been very enlightening and incredibly informative. So thank you for your wisdom, and thank you for all that you do. And I really appreciate you being on the Gut Reset Summit.
Thank you so much for having me, Dr. Dempster. It's great to see you again.
You as well. We'll see you soon.